3D printing has completely changed the way that we are working in our practice. We have this possibility to have a much better interaction with the patient. We have reduced, I would say, almost to half of the time that they have to come to the practice. We are reducing the times of the treatment. Especially in the restorative part, we are slowly moving more to same-day dentistry. Clínica Ramírez is a multidisciplinary clinic that we have here in Las Palmas for almost 100 years. We combine cutting-edge technology with also a lot of information of oral health with biology and function. My grandfather was the founder, and then my father continued the legacy. Then after, my brother and myself studied dentistry, and now we are continuing the work of helping the people to have healthy smiles. With technology, we are able to achieve a much better connection and interaction between all the disciplines in dentistry. We started to use CAD/CAM technology almost a decade ago. Initially, it was more related to diagnostics, but due to the evolution of this technology, we are using now as a daily routine practice. From diagnostics, treatment plan, but also to execute all of the cases. What we have in-house in our clinic is the intraoral scan, CBCT X-rays to communicate also and to diagnostic and treatment plan, and 3D printing. And we add also in-house 3D softwares that are helping us to connect all this technology. Since we have everything in-house, we are able to scan, design, and manufacture in a very, very fast way. So we have seen how we can reduce the times of the treatment of our patient. Having the Form 4B is completely changed the way that we are executing the cases. For example, in cases that we are doing ortho and we need a fast model to be done, using the fast model resin, we are able to produce a model like in 8-9 minutes, so the patient can stay in the clinic, we print the model and we give a retainer. Some other cases, for example, that we need to do like a bite splint or a night guard, we are also able to execute the case the same day or even the day after. We have 3D printers today actually running full-time in our practice. For me, one of the most relevant things that using the Form 4B is the easy to use. So another big benefit that we see is also the predictability. We have the auto mixer, we have the cartridge, everything is together connected. In the daily routine practice, being able to delegate and to have a team around you is one of the key points to be successful at the end of the day. 3D printing is completely changing the way that we are doing restorative dentistry in our practice. Not only for implantology, that has a very important part, but also slowly to the natural tooth restorations. We are using ceramic fill resins like Trinic and Premium Teeth, mostly for impartial restorations like inlays, onlays, tabletops, overlays, single units for doing immediate loadings, but also in full large cases to have the capability to communicate with the lab and do these aesthetic try-ins. We start using them especially in single units instead of doing, for example, big fillings that we don't have like good contacts and we don't have the correct anatomy. So one of the big benefits that we see with this type of restoration is the fitting. We see that the marginal adaptation over the natural dentition in the margin is truly amazing. And if we move to implantology, the fitting over the type basis is also very, very accurate and doesn't have the problems that milling can have in the margin. So we have already cases with 3 to 4 years, especially in single units. We see a little bit of wear of the restorations, but the integrity itself of these specially selected single unit cases, it's very, very nice compared especially to what we have seen in the past doing direct bulky fillings. In my practice today, almost 95% of our cases are fully guided in terms of the surgical part, with the prosthetic part already combined on it. 5-6 years ago when we were outsourcing, we saw that we had to schedule the surgeries a long time ahead. Now that we have the capability of designing and production in our practice in-house, the same day that we acquire all the information of the patients, we are able to set up the surgery maximum in 2-3 days. The main benefit of doing like surgical guided implantology is the control that you have for the surgical part of where are you placing your implants. But in the other hand, in most of the surgeries, you are less invasive. You know that you have more accuracy on placing the implants, but you don't have to be so much aggressive in terms of doing the surgery. In cases that we finish, I would say, ortho and the patient needs like a night guard, so we are able to have this like in the same day or the day after. I feel safe when the patient have the splints because I know that everything is protected, especially in patients that have invested a lot of time and money in full arch restorations of their natural dentition or in implants, so they don't need to wait so much time to have a protection. 3D printing is part of our family and is one of the key points to achieve success in our practice. My advice today to the people that have an intraoral scan is that they need a 3D printer. When you jump into the beautiful world of 3D printing, you don't need to cover everything the first week that you buy the printer. You can outsource designs and then receive the STL and print at home, for example, for night guards. But the very beginning, I will go slowly, going with models and doing the smile designs, and then after a little bit of time, your team and yourself will get more confident. You will get more knowledge about the designing phase that is becoming easier and faster with AI, and you will start to do everything in your practice in-house.